The most expensive cancer case over the last few years cost $5.41 million. And although it can feel a little bit cold talking about cancer in terms of numbers and dollars, the fact is cancer is causing an economic crisis in US healthcare, and employers are paying for it. Over 60% of Americans between 18 and 64 are on their work's health plans. And for most companies, by and large, those plans get more expensive every single year for employers and for their employees. One big issue is that many cancers are diagnosed at later stages. Treating an early stage cancer can cost thousands of dollars, but treating a late stage cancer can cost millions. And beyond just the numbers, on a human level, getting a late stage diagnosis can be devastating. It typically means more invasive procedures and often much higher prices for that person. So what's the solution here? Well, in this video, we'll look at how 3 AI startups are trying to change how we find and treat cancer, and whether they can actually slow down the rising cost of healthcare in America. And one of them, Immunai, may actually hold the key to avoiding dangerous drug side effects based off your unique DNA. Let's dive in. The cost to treat cancer in the US is expected to rise to $245 billion by the year 2030. So if you think your insurance premiums are high now, just wait a couple years. Also, just for reference, the GDP for the entire country of New Zealand was just $247 billion last year, meaning the cost to treat cancer in the US will almost equal the total value of everything produced and sold in the entire country of New Zealand. I'm trying not to be overly dramatic here, but that is crazy. And a lot of it has to do with the costly treatments that have entered the market to treat cancer, many of which are used as a last resort in those later stages. This particular study looked at 600,000 people who got cancer and found that those diagnosed at later stages had higher costs of care, up to 7 times as much than those diagnosed at earlier stages. So first and foremost, if we want people to have a better chance of survival, and secondarily also lower health costs for everybody else, we need to identify cancer earlier. That's what the AI startup Freenome is attempting to do with a blood draw. Its technology, a form of liquid biopsy, uses machine learning to scan blood for microscopic clues, so fragments of tumor DNA, subtle shifts in protein, or even immune markers. Together, those might signal the very early stages of cancer. Freenome's first test scanned for colon cancer, a cancer that's often asymptomatic until it's advanced. And today, only about 60% of Americans actually follow screening guidelines for colon cancer. Some of those unscreened people go on to develop late-stage colon cancer later, lowering the chances of survival and driving up the cost to treat them. If more people get screened with a quick blood test, more cancers will be caught at stage 1 instead of stage 4, avoiding expensive surgeries and chemotherapy down the line. And economic models support this. Treating colon cancer early costs a fraction of late-stage treatment. Freenome is still in regulatory stages right now, but one potential issue here might be the total cost of the test. We'll see what that ends up being. But what about brain tumors or kidney cancers that might not even release anything microscopic in someone's blood? How do we go about detecting those earlier? Although it's not just these two cancers, brain and kidney cancer often go undetected in blood tests because they release little to no tumor DNA into circulation. I had no idea about that before I did research for this project, but barring any major advancements, it sounds like Freenome wouldn't really help the late-stage cancer diagnosis problem for cancers of this type. So what can be done? Well, an AI company named Ezra focuses on imaging, using artificial intelligence to make full-body MRI scans faster and cheaper. Whole-body MRIs can often detect cancers that blood tests miss, including in organs like the pancreas, kidney, or liver. Historically, though, the limitation has been cost. A full-body MRI takes over an hour, requires radiologists to review images, and can cost several $1,000s. For most people without a referral, MRI is kind of out of reach, a tool for the ultra-wealthy. But Ezra's trying to change that. Its software, called Ezra Flash, gained FDA clearance in 2023 as the first AI capable of accelerating whole-body MRI scans. The system optimizes image capture and uses machine learning to assist with image interpretation. So it cuts scan times from roughly 60 minutes to about 30. That efficiency actually brought the price down from $2,000 per scan to $1,350. Still not accessible to everyone though. But in 2025, after merging with Function Health, Ezra reached its public goal of offering full-body MRI scans for $499 each. Ezra likes to highlight stories like a client who, 45 and symptom-free, had an Ezra scan and actually found an early-stage kidney tumor. It was removed promptly, likely saving his life and probably sparing him the cost of metastatic kidney cancer treatment, which could involve immunotherapy drugs at $100,000 plus per year. But there's still some major challenges here. Whole body MRIs can produce false alarms that lead to costly follow-ups, and insurers still don't cover them for healthy patients. In fact, the US has been criticized for referring patients to MRI too much, basically increasing costs with increased false alarms. Ezra's AI is being trained to filter out harmless findings, which could make scans more accurate and cheap enough to be offered routinely, but there's still the chance that more MRIs will lead to more expensive and potentially unnecessary procedures. procedures that may or may not even work, which is what the next company is trying to solve. Even with the best screenings, some cancers still progress to late stages, and treating those cancers can be crazy expensive. Immunotherapy drugs like Keytruda can cost over $100,000 per patient per year and often need to be given for months or years. In 2021, only 12% of US cancer patients received immunotherapy, yet those treatments made up 36% of total oncology drug spending. The average immunotherapy patient accrued $132,600 in drug costs, compared to about $26,000 for those on older therapies. Patients want the newest and best drugs, and why wouldn't they? The problem is, these drugs don't work for everyone. That means a large share of patients endure side effects and very high costs without any clear benefit. So the third AI startup, Immunai, is mapping the human immune system at a single cell resolution, essentially creating a map of how immune cells behave during disease and treatment. The goal is to remove the guesswork from immunotherapy by predicting which patients will respond to which drugs. Their platform's called Amica, and it uses single-cell genomics and machine learning to analyze thousands of immune cell types in a patient sample. From that, its AI can identify patterns that signal whether somebody would respond well to a certain drug or if they're more likely to get side effects. Obviously, you're going to want this to be almost perfect because you don't want somebody missing out on a drug that could actually really benefit them. But at this point, it's not even available to consumers right now. In fact, Big Pharma has actually been looking to access Immunai's platform. So what do these three AI tools mean for healthcare costs? Will they actually help us bring costs down? AI in cancer care will likely change how healthcare dollars are spent. Freenome and Ezra are trying to shift money away from expensive late-stage treatments toward early detection. And spending thousands up front may help avoid million-dollar claims later. For insurers and employers, that's an appealing trade, but most insurance companies still don't cover these kinds of screenings. So far, only a few early adopters, mostly self-funded employers, are testing them as wellness benefits. Their logic is, if they can catch one cancer case before it becomes a $3 million cancer case, they can offset costs for everybody. It's still worth it. Still, false positives and unnecessary procedures can raise costs for everybody if it's not targeted toward just high-risk groups. To conclude things here, a recent analysis estimates that over the last 25 years, improvements in screening and early detection of cancer saved the US healthcare system $6.5 trillion. But more importantly, it saved a lot of people's lives. And ideally, these tools will do the same for even more people. If you found this video interesting and you'd like to see more like it in the future, please consider subscribing. This is Tyler Dutchover. Thanks for watching.